So we start in the county of Mombasa, where Kevin Mutai went into a COVID-19 ICU ward. Kevin, it was quite the experience, I believe.
It was quite a sobering experience. We got to speak to a couple at the Coast General Hospital who were gracious enough to speak on camera, yet the man was on oxygen support. At the Coast General Hospital in Mombasa, we gained exclusive access into the COVID-19 isolation wards. But first, we had to dress for the occasion, get ready to get into the battle zone. On any other day, this lady would be going about her work in the hospital as a nurse, but she is on the other side of the situation. The alarm came when her husband started feeling unwell and was admitted at the Aga Khan Hospital, Mombasa. He then continued to have trouble breathing, and they both underwent COVID-19 tests.
After 2 days, the Aga Khan Hospital called me, and they told me we are transferring your husband to General. Even without any further ado, I already made my conclusions. I knew the COVID test was positive.
They came to learn that she is the one who initially contracted the disease while at the hospital after coming into contact with an asymptomatic carrier. She then went home, and her 61-year-old husband also got infected, while his wife is asymptomatic. He is among the 3 patients admitted at the intensive care unit. He has underlying health conditions and is receiving oxygen through a high-flow nasal cannula, which supplies more oxygen than a ventilator.
It's so bad. Wow.
Feeling better.
Better.
Yes.
Far much better.
There are people out there who feel that this disease, that coronavirus, is not real. What can you tell those people?
These people, they are very wrong. This thing is very real. They don't have to joke with it. But it's very real.
COVID is real. I myself, I have tested it. And it's not a joke. But I'm not sending out fear, but I'm sending out a word of precaution. But let's be careful and take care of one another, especially our families.
Do you still have a difficulty in breathing?
Because they all fit so much.
His wife requested to be in the same ward as he is so that she can take care of him, exemplifying the sections of wedding vows that say, for better or for worse, and in sickness and in health.
Luckily, this patient, who was saturating at 65%, has now stabilized and is saturating at 93%.
He looks forward to joining this other recovered COVID-19 patient. Anderson Bongo, who recovered after 26 days of treatment, was discharged after testing negative for the virus. He says he spent 3 days in the ICU after developing respiratory distress.
Maisha ya ICU ni magumu kwa sababu uko katika kitanda chako, alafu hapo karibu yako mtu anaaga, ama hapo karibu yako mtu hali yake ni mbaya sana. Kwa hivyo uko pale lakini tu uko katika hali ambayo nitasema sijui ni wasiwasi.
This lady patient, who is also a nurse, says that there is need to further support healthcare workers such as herself.
I would like to send this to our government that it's good that we have PPEs for the other staffs, especially those who are working in casualty, the wards everywhere, because they are dealing with patients they don't know, who are maybe asymptomatic, or those who are already symptomatic, but before they are confirmed, those nurses, doctors, all the people working in the hospitals are exposed.
Some of the things we saw in there are easily life-changing. Seth Olale has an almost similar experience with a slight twist in his angle. Seth, I felt the reality of COVID-19 hit me while I was in there. Was it the same for you?
Well, Kevin, it was shocking. An experience that can turn an unbeliever in the existence or extent of the disease into an evangelist of its reality. I spoke to a nurse at the Kenyatta National Hospital Infectious Disease Unit's intensive care unit just to get a sense of what's like for a frontliner.
We are taking care of patients who have COVID-19 disease or who are suspected of COVID-19 disease. There is the fear of what if one gets infected? What if in the event of providing care for the patients, I also get infected? When we arrive, we change into the appropriate uniform, and then we take the patient's report, and then we plan for the patient's care as based on the report that we have. Twice I have had a cough, and that was very scaring. I went for testing, and after a day I had the results which tested negative, and that now allayed my fears. But obviously every time you have a symptom that is COVID-like, then you also get worried a bit. The initial phases were very low moments for my children especially, because I remember one of the first weekends we had was after the news about the positive patient. Then all of us were fearful that we may have been infected. Yes. And so conversations were more of, just in case I get infected, then I'll have to go for isolation, quarantine, and that is something they had to start getting used to. I also had to let them know that in case I am away, then the family needs to run. And that is now a conversation with my husband. I'm married. And things need to go on as normal.
Have you ever lost a patient, unfortunately?
Well, sadly, yes. As we speak, we are at the COVID ICU. And we have lost patients. And it is not a very good experience. When I am away from my workplace, I find time to unwind with the family, especially nature walk. I love nature.
Have you had successful recoveries?
Oh yes, I think the successful recoveries are many from our statistics. I'm not sure we can tell the end. What I'm sure of is COVID is here, and we all are doing our best in responding at different levels, for us as frontline health workers, but for the rest of the population, following the Ministry of Health guidelines. That is how we together can actually overcome COVID. Very important is my spiritual foundation. It lays the basis. I kind of have a guarantee that I am getting into caring for patients with COVID. Not alone, God is with me and with the team.
It was a tough one, I must admit. And to think that not everyone can access the treatment the world is receiving in some counties is even more concerning, isn't it, Leila?
It is, Seth. You know, in some counties, if you get infected and need to go to ICU, then you face an even bigger problem because they do not have any. This is a look at the preparedness of these counties.
The numbers are rising, and so is the concern. The COVID-19 pandemic has exposed weak and wanting systems in the country. By mid-June, the Council of Governors had raised the red flag that counties are ill-prepared to deal with the surging numbers of patients.
This is a period of great tests for the concept of devolution.
To boost their preparations, the governors wanted President Uhuru Kenyatta to give them much more money and time, but the head of state opened up the contained counties and by extension opened more opportunities for infections.
We have reached a reasonable level of preparedness across the country. And I repeat again, we have not yet met 100%.
Counties were expected to have at least 300 bed capacity for COVID-19 patients in their hospitals. Only 23 of 47 counties have achieved this.
Nafikiria tukifika mwisho wa wiki ijayo, kaunti zote zitakuwa zimefikisha vitanda 300 vile inatakikana, na wengine wataenda zaidi.
In the green corner are Nairobi, Mombasa, Machakos, Bungoma, Laikipia, and Garissa, which have hit the 400-bed capacity mark. 10 other counties have achieved the 300-bed target.
The county government of Makueni has also achieved the 300-bed isolation capacity in line with the directive given by His Excellency the President. Congratulations to the Makueni government. In fact, from this morning's discussions, Makueni is actually waiting to upscale its capacity not only from 300 to somewhere close to 800.
Kiambu, Kwale, Uasin Gishu, Nandi, Trans Nzoia, West Pokot and Nyeri have slightly more beds in various health facilities in their counties. While the current number of people who have tested COVID-19 positive stands at over 8,000 and each day recording not less than 100 new patients, facilities are getting overwhelmed. The Health Ministry says that over 80% of the cases are mild and need short-term hospitalization or home-based care. Those in need of specialized care face the reality that the country has just under 500 ICU beds in public hospitals. Vihiga, Elgeyo Marakwet, Samburu, Tana River and Embu have 0 ICU beds in their hospitals. Therefore, if you get infected while in these counties and need to be taken into ICU, yours is a greater predicament.
The reason why we are saying that moving forward, there will be no evacuation of persons for COVID complications from the counties to Nairobi. Not out of will. It is out of the fact that by the time we get to that position, the hospitals in Nairobi are themselves going to be overwhelmed.
It is not bad, but not as comfortable for you if you get infected in the likes of Uasin Gishu, Makueni, Kilifi, Busia, Turkana, Garissa, Bomet, Isiolo, Wajir and Laikipia. These have less than 10 beds in the ICU wards. Murang'a, Machakos, Kajiado, Nakuru, Kisii, Trans Nzoia, Nyandarua and Kiambu have just above 15 beds in the ICU wards. Murang'a has the highest number of beds in the ICU outside Nairobi. As the movements and interactions increase, Kenyans are faced by the stark reality that there are 442 ICU beds and 437 ventilators in the country. This points to the pleas for individual responsibility.
So you need to keep safe, you need to sanitize, clean your hands, wear your mask, and most importantly, keep physical distance at least 1.5 meters away, and make sure you just keep yourself safe, because despite all these freedoms they have been given, you need to be on the lookout for the small things that may lead into bigger trouble. Isn't this the case, Okusa?
Well, Leila, very much so. Indeed, we have so many risks that we are facing even as the freedoms increase. I looked at how Kenyans needed to be petty if they want to sit pretty and uninfected. Here is my story. Our first stop was at the open air market next to the Moi Stadium. Here, we found traders and buyers going about their business as usual. Enoch, popularly known as Olorio, is a hawker here.
Huwa nasonga kando napea mtu pale kwa umbali kidogo, namkatia majani, nampa na yeye anane. Kama ni pesa mingi ananitumia kwa simu. Kama ni pesa kidogo, niko na sanitizer, nikishika ile pesa nashika mara moja, naosha mkono. Alafu ndio naingiza pesa kwa mfuko.
Kuna sanitizer unahakika mzee?
Niko nayo.
Hebu tuonyeshe.
Niwaonyeshe sanitizer. Sasa hii. Sasa nimeachia customer mwingine pale, naenda kuichukua sasa hii.
Just like the rest, Enoch has a challenge in observing all the COVID-19 containment measures.
Ni ngumu kuzingatia na Mwafrika na ni Mkenya pia mimi. Ni ngumu kidogo, lakini tunaomba Mwenyezi Mungu.
The nitty-gritties that many people face as they go about their days and nights leave them dangerously exposed to the coronavirus disease. A key one is the use of cash, which is still rife in some areas. Other situations such as this one here, where people find themselves touching a potentially contaminated surface and unknowingly exposing themselves to the virus, are rampant.
Sanduku yenyewe tunabeba naye nyanya kama hii ya nyanya. Inaenda inarudi, mwingine anaichukua, wewe mwenyewe ulishaibeba. Sasa kuepuka hapo ni kujaribu tu, lakini ni ngumu, manake ni maneno ambayo tukua tumezoea.
Then there is the matter of wearing a mask while in public spaces, a measure that a sizable number of Kenyans only take to avoid trouble with the authorities. The difficulty of observing social distancing is, however, not only confined to open-air markets, but also in public transport vehicles and even supermarkets. To many people, some of these measures may look petty, but
if we continue to behave normally, this disease will treat us abnormally.
The government and health experts have repeatedly pointed out that the points of exposure are numerous, especially with the increasingly open economy. Well, these are the realities and the measures that have been spelled out. But how well are you going to adhere to the rules? My colleague Olive Barros brings home the personal responsibility.
Okusa, as you pointed out in your story, despite the repeated assertions by the Health Cabinet Secretary Mutahi Kagwe that if we continue to behave normally, the disease will treat us abnormally, it is undeniable that we have doubting Thomases among us. It is also undeniable that there are those who view these precautionary measures that we are all meant to take as an inconvenience rather than life-saving. But as the adage goes, with freedom comes a responsibility.
This is Bob. Bob thinks he's immune to the coronavirus, or it's one big hoax. Don't be like Bob. It's now been 3 months and 25 days since Kenya confirmed its first COVID-19 infection. 3 months and 11 days since a curfew was imposed, and 2 days since President Uhuru Kenyatta lifted a cessation of movement order into and out of the Nairobi metropolitan area, Mombasa and Mandera County. In that time, terms such as social distance have become a part of our everyday vocabulary. Masks have become our shields, and sanitizer has become a precious commodity. In this new normal, it has also become evident how even the best systems can be overrun in the face of a pandemic. The unrelenting message: you are responsible not only for yourself, but you have a duty to be your brother's keeper. The coronavirus having shown itself to be no respecter of persons.
Let it be clear that the torch of responsibility as to whether you are safe or not safe has been passed to you, has been passed to the church, has been passed to the office, has been passed to the county government, has been passed to Kenyans in general.
Kenya, like many other countries around the globe, now finds itself at a critical juncture, forced to reopen as it's now confronted with an ailing economy, even as it grapples with an increasing number of infections. And if the two nations with the highest number of COVID-19 infections and deaths, the US and Brazil, have taught us anything, it's that we can be our own worst enemy. Denial and a lowering of one's guard proving lethal.
Twasikia watu wakisema hii ugonjwa si ugonjwa wa kweli kwa sababu mtu hajui, mtu sio kitu unaweza kushika ama kuona. Na wengi ambao wanaopata wanapona, ni kweli, lakini nataka niwaambie ya kwamba pia idadi ambao wanapata huu ugonjwa na wamelazwa katika mahospitali mbali katika taifa letu, idadi yao pia yaendelea kupanda.
If ever there was a time when leadership has proven a deciding factor between life and death, it's now. And as actions speak louder than words, President Kenyatta's administration can admonish the citizenry until the cows come home, but only when its walk matches its talk can the virus be treated with the seriousness it deserves.
Uhuru, wewe una mamlaka ya kuleta hao viongozi wote na joto ya kisiasa ipunguzwe. Tutajua tunashughulikia corona, tutajua tunashughulikia siasa ya BBI, tutajua tunashughulikia siasa ya Senate na bunge. Wewe kama kiongozi wetu na tunakupenda, punguza joto la kisiasa katika nchi yetu ya taifa na uendelee kusuluhisha mambo ya corona.
Olive Barros, NTV.
Well, Mark, I'm optimistic that with tonight's team coverage, we've converted more than a few deniers into believers. Back to you.
And in the same breath and with the Bible, I will say, he with the ears, let him hear. Matthew 11:15.